regarding the checks for Sunita Lough. So there are, of course, concerns about how soon they're going to start issuing these checks. And you already mentioned that the checks will take longer than the direct deposit. But what is the frame of time when people can expect this to happen?
We are hoping that the direct deposits will be out the people should have their money in their direct deposit accounts by April 17th or 18th, something like that. The checks will go out in lumps, starting with certain AGIs. But again, if you have a bank account and you haven't provided the direct deposit information to the IRS, you can go on the IRS website, which will be up and about the same time as direct deposit, like April 17th. You can give us your direct deposit information and the money will go out much faster.
And is this a one-time payment?
It's a one-time payment by statute.
Okay. Is testing free for all with or without healthcare at this time? And I would add, and available, because in many places you still don't have the test. Who can answer that question?
I can start. So this is Kerry at the Immigration Hub. So there is testing available at community health centers. Obviously it depends in your area about, the procedures for testing in general. But just in terms of immigration status issues, you can definitely go to a community health center. I think treatment is a difficult situation because obviously people go to the hospital if they need treatment. But if they're not covered by insurance, it's obviously going to be an economic issue at the end of the day when they receive the bill from the hospital. So that's where we were trying to get coverage through emergency medicine.
What about unemployment, Sebastian? This was a question that somebody was asking you, and maybe you already answered privately, but do business owners have a right for unemployment if they lose their business?
No, you have to be an employee to be eligible for unemployment assistance. So as a small business owner, even if, let's say, you're the only worker, you'd still have to pursue assistance through the SBA loans or other loan forgiveness programs. You have to have an employee relationship. Other than to throw more hours, more people working on it and adding more staffers to those agencies. And I know that, at least in California, that they have been trying to do that as much as possible. But beyond that, beyond improving the technical infrastructure and adding more people, there really isn't much more that can be done. The silver lining is that claims will be backdated. So even if it takes time, money will get to people for all the weeks that they have been waiting.
Thank you, Sebastian. There's a very interesting question here. U.S. citizens who are now outside of the country due to any reason and they can't come back, are they qualified to get the relief payment checks from government? Sunita Lough, unmute yourself.
If they're, so U.S. citizens who are outside the country, if they don't need to do anything, they file the 2018-2019 return. We have their information. If we just not direct deposit, they will get a check. It'll be in their house when they are able to come back. So if you're a filer, if you were not under the taxable income, they don't need to do anything.
I have a question in regards to the Haitian community in New York City, and I think maybe Dr. Walton or maybe Kerry can address this. It says here, Bianca Silva covers the Haitian community in New York City, borough of Brooklyn more specifically, and many lack access to health care as it is often experience long wait times and conditions that go under the radar. With large social gatherings happening around them despite the strict guidelines, what can they do to protect themselves? I think Dr. Walton could talk about this. Thank you.
We really do need to go back to the basics, but also recognizing that we have to meet communities where they are. Whatever the underlying community behavior that keeps the community members gathering, begin with meeting them where they are. You can gather without touching. You can gather by really working on being 6 feet apart. You can make wearing a mask part of what we all do. Encouraging hand washing, encouraging open spaces, encouraging behaviors that remove sort of that physical touch that we're so used to doing. Meaning we are in a situation where we have time, we have energy to join this fight So what I would encourage, if you have the time, the energy, to be creative and innovative in your in problem solving, I would appeal to the reporters, make this an issue and put out look for and encourage fellow community members to watch out for those elderly who are alone. We've seen so much of the negativity, but if we're paying attention, there's so many amazing grassroots, community-oriented projects and activities. We can start with something as simple as the number of masks that are being made at home. My sister, who can't even sew 2 pieces of cloth together, has been making masks. She figured it out, and do you know what I'm saying?
Yeah.
We can stand up and say, each one of us, what can I do to help fight this pandemic?
Thank you, doctor. And we have another question for one of the medical doctors, I would say Dr. Wen or Dr. Turner-Lloveras. We still see dozens of people inside shops, and this helps to increase the number of people infected. Do you think there should be a curfew? Do you think stronger measures to limit the increase in the number of people infected with the virus? It seems that some of the local governments have been hesitant.
As of right now, what we can do is we can provide real housing. So what Los Angeles has done, they have set up these trailers near Dockweiler Beach in Los Angeles, and they're provided free of charge right now it's reserved for a homeless population that tests positive. But what we really need to do is, the shelters are not always safe. And if we really want to have this virus contained, then we need to offer something where the person feels safe. And there are buildings that are not it's much easier if you have internet access and you're able to also be offered telehealth, telemedicine solutions. That is not equally offered to the underserved African American, Latino communities. And so what can be done right now is either policy changing and having internet companies go in and provide internet access, whether it be through hotspots, or that could be done in a matter of days, and then have these populations be offered the same type of care that's being offered to those with internet access. And then you can actually seek care while staying at home and prevent the spread of the virus. And I think that's something that really should be addressed as well.
Thank you so much. Sunita, thank you so much for this great initiative and for recruiting such terrific speakers. We really are honored by your participation. Thank you.